Hey there, I'm Dr. Greg Barnes at Triangle Health Center, and we are located at the corner of Chapel Hill Road and Northwest Cary Parkway. Over the past 11 years, we've been serving literally thousands of patients across the Triangle area and even beyond that. And one of the things that we most commonly hear from patients that come to our clinic is that they notice that our office is so unique and so different, certainly from their medical offices that they've been to, but even their chiropractor, if they've been to a chiropractor before. And the main thing that really separates our office from other chiropractic clinics is the type of care that we provide, and that's called corrective care. I thought it'd be cool to just show you what corrective care actually looks like, what a typical visit looks like in our office for that. So come follow me. So come on in. All right, and then she'll lay down. So here in the adjusting room, one of the other things that is unique about our office is that not only do we take x-rays on a patient's first visit, but we also take progress x-rays along the way as well. So in my room here, I have her x-rays, her most recent x-rays that we've taken on her pulled up on the screen. So beyond the feedback that the patients give us, what they're feeling and what they're noticing as well, I have her x-rays here so we know exactly the areas to be focusing on and what to be helping to help her body be at its absolute best. So I'm going to go ahead and do the adjustment now and explain a few more things. Good. So we use that, the table there, she has one hip that's a little bit lower on the right hand side, so we're using that table, that drop technique to help to realign those hips. Okay. Deep breath in, all the way out. Got it. Good. All right, another breath in. All the way out. Beautiful. All right, turn over on your back. Now, when it comes to the adjustment of the neck, I found that it can be kind of a polarizing topic for chiropractic patients or non-chiropractic patients, and a lot of that comes from misinformation or even just personal preference. So I know that Ash likes to get her neck adjusted, with the hands and manually. So I'm going to show that, but I'm also going to show the tool that we use called the arthrostim on people that don't prefer to have their neck cracked or popped, if you will. Beautiful. All right, you can go ahead and sit up for me and face that way. All right, obviously didn't hurt. She's not crying, no tears, any of that stuff. So we'll use the arthrostim as another way to adjust the neck, and even for people that do get adjustments on their neck with the hands, we use it as well because it's a great postural correction technique. With most people, working at computers or on their phones far too much, this tool really helps to rebuild that posture, and like we talked about, changing the actual shape and structure of the spine too. So I'm going to do that right now. Great. I know when people first hear that too, they think it sounds a little bit like a machine gun, but it's actually very safe. It's very controlled. We use it on pregnant women, on even little kids as well. So it's very safe, for that. So after we get her, the adjustment, the next part is we want to really lock that adjustment in. So then we go over to our post-adjustment rehab area. So go ahead. Then she'll step on a vibration platform because the vibration helps to really we always just say it seals that adjustment in. This is vibrating here. It's having her body having it correct, and it's strengthening these muscles around her spine here so that those adjustments not only last longer, but more importantly that over time we're actually getting specific and predictable changes in her spinal health. So that's what a typical corrective chiropractic care visit looks like. And we want to let you know that for everybody that's watching this right now, we have a specific offer, a special offer that we're doing if you see this on social media. So your first visit will include an exam, consultation, any x-rays that are necessary, and then what's called a doctor's report of findings. So you have a chance to view your x-rays and really see what's going on with your health right now and maybe what's causing your problem. Beyond that, there's really absolutely no pressure to become a patient here in our office. We just simply want to inform you. The majority of people that come into our office decide they do want to become a patient because they love our unique approach to care. So go ahead and click on the link anywhere that's not in this video right here to find a time that works for you and reserve that right away. And we look forward to seeing you soon, and we'll see you on the next video.